Hello, everybody. Again, Vivek Shandas, he, him, his. Grateful to be coming to you, at least here in Portland, traditional ancestral lands of the Multnomah, Clackamas, Tumwater, Watlala bands of the Chinook, Tualatin, Kalapuya, as well as many other flora and fauna that have been here for time immemorial and along this river known by the indigenous communities as Wimla, Nichawana, and more recently, Columbia. I'm here in my home in Northeast Portland, a historically redlined part of the city of Portland, a place that has seen a lot of transformation over the years. More recently, a big transition of African American, Black communities that have lived in this space that have been essentially displaced and gentrified out to other parts of the region. So there's a lot of dynamic work happening in our cities, and I'm hoping to get into some of that with you today. Let me go ahead and share my screen, get us started here, and plan on just kind of going through a little bit of the work that we've been doing on built environment dynamics and urban heat, to introduce myself a little bit to you in that process, as well as some of the more recent findings. I will note that some of these findings that I'm going to present today are in publication, so I would warrant some caution before I get started in reproducing them, and only reproduce them once they are published, which I'll describe when I go through each of this material. I identify as a professor as well as an advisor. This is a chance for me to have one foot in the university as well as one foot in the practice. I was lucky enough to be in Portland State University, where the motto is "Let knowledge serve the city." So from day one, I've been working with community practitioners to really work on various issues related to environmental planning, and over the last about 15 years on heat specifically. I grew up in about 8 degrees above the equator, where the temperature is hot all the time. There's a rainy season that's hot, and there's a hot season that's even hotter. And this was my first experience of the physical world, and it has transformed a lot. South Asia, including heat waves that have been upwards of 2 to 3 weeks long, over 50 degrees Celsius. That's upwards of 110, 115 degrees Fahrenheit. And nowadays, my relatives tell me that the mangoes ripen in March. What used to ripen in March now ripen in January. So lots of changes going on there. I've lived in Seattle. I've lived for a little bit of time also in other parts of the Northwest, but most of my time has been in Seattle and here in Portland, where I thought I was running away from the heat. And while I have been in the Pacific Northwest, I've really started working on issues of heat. Back in 2009, I'd published a paper here talking about a climate justice response and social inequities that was really targeting the idea of heat in specific neighborhoods of Portland, and trying to get at the fact that this kind of storm that we had seen in years past, in 1995 in Chicago, 2003 in Western Europe, and with the hundreds and many cases thousands of people that died as a result of heat, I saw this as a opportunity to really work here in the Pacific Northwest on something people weren't paying attention to. And I got mostly chuckles and laughs saying this is a temperate climate. This is not some place that we're going to see extreme heat. It's a place that we're going to be pretty well adapted to. And I heard a lot of this over the last decade and a half of this work. And lo and behold, in 2021, as you've talked about in previous seminars, this heat dome arrived, and the entire conversation changed on a dime. Literally over 3 days, the entire Northwest took attention to something that many of us had been kind of waving flags about for decades past. And so we continued writing. This was a more recent piece that came out in 2023, where we looked closely at the heat dome and potential responses that the city of Portland took, and what might be ways in which we can better prepare for any future heat events based on what we learned. And I know that's an ongoing theme of this particular conversation and discussion. In my kind of intersection of academic and transition into consulting work, I spent a lot of time looking at the natural and built environment thinking about occupational exposure, health, and specifically looking at health and healthcare, well-being and social cohesion. These are themes that transect the work that I've been involved with, and it really has taken on kind of an approach where we're doing heat hazard assessments at very micro or hyper local scales, thinking about where that heat affects communities using some background and context assessments, getting into identifying intervention strategies, and then we move into this idea of implementation guidance in this work. So this is kind of the framework we use. And to kind of deepen this a little bit, the relationship among the different themes really plays out in a variety of ways by specifically thinking about risk. What are the risks that a community would face? And then how do those risks help to understand and underscore actions that are effective and directly in response to the risks that we know a community face? And so again, we're at the 10,000-foot level here, and I want to kind of take this down a little bit to a couple of case examples. Though before I do that, I want to just kind of tie together a number of themes that I've heard in previous seminars, as well as kind of linking it to themes that we've been working on. So when we're thinking about natural and built environment, a big part of that is in relation to kind of what happened before us, kind of past land use histories, what the physical geography is of that place, what kind of social responses do we have to heat in terms of the integrity of the energy grid, cooling centers that a public health agency might put forward, the amount of gray-green infrastructure, what the building codes are, and a variety of other factors that mediate how the natural and built environment affect our health and well-being. That then is linked to a number of different ways. It's linked directly, and the drivers of that built environment are affected to exposure dynamics, where we spend a lot of time trying to understand what's directly on the skin of people, how much do they heat do they experience, and does it vary by if you're a day laborer, an outdoor worker, a school, someone at school, and then how do those regulations affect it? Those in our conceptual approach are then tied directly to the effects of that on health and healthcare of communities. And that's the level of coping capacity as examples, early warning systems that people are aware of that have come up in the past, mental, emotional health of communities to respond, have efficacy of response, citizenship status, accessibility and availability of healthcare, emergency response, lots of themes that again have come up here. And then I tie that back to the idea of the health and healthcare have capacities that will enable well-being and social cohesion. And that is another set of factors that really kind of moderate and co-mediate the ability for communities to respond well to heat. And this is where, right in the center of all this, is where heat risk monitoring and assessment really plays out for us. And the way we tend to think about how heat risk is then understood, how we go about assessing it, and then ultimately what kind of actions we decide. Much of what we're doing, I will say, in heat right now is very ad hoc. It's very kind of responsive, reactive. It really isn't systematic and set up in a way where we're really assessing the risks at a very local level, experiential level. And so that's at least what we're starting to hopefully have conversations about. And I want to just touch on a couple of examples of why I underscore that so much. A paper that we're about to publish coming out here is looking across the United States, where we're looking at predicting future heat risks in cities, and specifically looking at heat-related illness. And we kind of use a systems dynamic model to play out over multiple different factors, including air conditioning prevalence, age, various demographics, its physical geography, et cetera, in relation to heat-related illness. And we see that different regions have very different levels of heat-related illness that would play out. When we look at just the Pacific Northwest, when we're starting to just examine by race, for example, was one factor we could look at. We've looked at this by income. We've looked at this by a variety of different factors, as the model will allow us to do. We've been able to see the health-related illnesses or heat-related illnesses per, in this case, 10,000 people per year really varies. And in the Pacific Northwest, the folks who identify as other, meaning mixed race, including indigenous communities, And Asian communities are disproportionately affected in terms of what we see as potentially future impacts from heat-related illness across the cities in the Pacific Northwest. So the built environment interacts with um, the income, race, age, and other what we know as demographics pretty noticeably and measurably as we predict out to 2040 in this case. So again, we're applying this model now to Clark County this coming year. We're actually able to look at the county scale or even sub-provincial scale in terms of what we anticipate in terms of heat-related illnesses, as well as costs of those illnesses in the coming decades. We're hoping this will catalyze conversations about what kind of preventative measures communities can take, specifically targeting some communities that might be disproportionately affected. Um, at the metropolitan scale and the built environment, very rich in terms of the dynamics of how heat plays out. What we've really tried to emphasize in our work is to do these hyperlocal assessments of exposure. And that's where trying to think about whether Vancouver, Seattle, Portland, or other municipal areas around the Pacific Northwest, trying to go from the regional level to the micro scale has been our ongoing pursuit. And that's where we have been able to work with communities to understand what their exposures are at the very local level, whether it's on a sidewalk that's shaded or not, whether it's in a home that's got air conditioning or not, whether it's in a neighborhood that has a history of segregation or displacement or not. Those are many social dynamics that interact with the built environment to really amplify potential illness that can be emergent in those areas. Um, so that scaling is really at the core of what we're trying to do. And one example of that I'll start with is work that we've done in Vancouver, British Columbia. We've done this in Seattle, King County, Tacoma, Portland, and the Portland metro region, Eugene, Springfield, and then many communities along and over 75 communities across the United States. We've engaged community groups in conducting these heat campaigns where we're looking at outdoor exposure to extreme heat. Again, trying to go to a very micro or hyper local scale with sensors, empirical assessments of air temperature, not surface temperature, and trying to understand what the dynamics are at a very local level and who's exposed. Just last year, we finished a study thanks to Brendan and a whole group of folks from Washington County and Clackamas County on a Portland Metro assessment where we're covered the largest square area that any of these campaigns of the 75 plus that we've done now internationally. This was the largest one that we did, over 269,000 measurements. It was on a day where temperatures reached about 95 Fahrenheit. And then we were able to look across the region in the morning, afternoon, and evening, what those temperatures look like for individual households and neighborhoods. So again, very localized. Those data have now been starting to be analyzed even further, and I'll get into a little bit of that here, where we're starting to look at the built environment dynamics, where we're looking at the percent of population exposed to higher temperatures. We're looking at population density, for example, across deciles to see where are we seeing the highest proportion of communities exposed and what percentage of people are exposed to the highest deciles, and then really fine tuning down to the individual tax parcel scale, what are the potential vulnerabilities that may be emergent in that specific location. We've looked at it in relation to tree canopy, which is often used as a means for cooling neighborhoods. And interestingly, we're looking at that also in relation to the population density. These are a couple of just scatter plot graphs that I quickly show from the report that we produced for the Portland metro region that just came out recently. And I want to bring your attention to this kind of higher population density and higher temperature area, which are these places, small places in Multnomah County, Wood Village, Fairview, Troutdale, Gresham. Those are on the east side of our county. Those are areas that have been annexed into the city. Some of them have been, some areas are standalone municipalities like the four that are circled here. And I want to bring your attention to the only known decadal difference of air temperature for a metro region in arguably the world, but let me throw that out there and see if anyone can challenge it. We did a heat campaign in 2014 in the Portland metro region, covering the city of Portland. The red is the hottest areas, and the blue are the cooler areas. And very similarly, we did it again last year, and this is the first time I'm presenting this to show that 2014 to 2023, almost a 10-year difference there in terms of air temperatures across the city. And what did we find when we looked at what are the areas that increased in temperature the greatest at a 10-meter resolution? And we found that the areas that were farther on the east side of Portland, so again, those same areas towards Wood Village, Gresham, on the far right side of this city of Portland map are the places that increased relative in temperature the most for the city. So these are also the areas that have been historically disinvested, marginalized, and this is an area that brings us right back to questions of equity and who is it that we're actually doing this heat planning work for, and who is it we're trying to support in this work. So again, the first of this kind, and I don't have a lot of time to get into this, but happy to get into this with questions later. Just emphasizing that far side. And so once we understood this outdoor air temperature, we wanted to spend a little more time understanding what were the exposures of folks. And so over the last 2 years, starting in 2022, and we continued into 2023, a great collaborative that some folks, including Brendan, have spoken about with Home Forward, Bureau Portland Bureau of Emergency Management, and Multnomah County. That we've been engaged in this understanding of indoor air temperature. Partly because we really don't have great data on this, like we didn't have great data on outdoor hyperlocal temperatures either. So this is the next frontier, if you will, of trying to understand how the building's design, as well as the specific behaviors of the residents, affect exposure to heat indoors. And in this case, these are all public housing buildings where communities are at the 20 or 25% of the median household income for the region. So relatively low income communities. And I don't want to spend too much time on this, but are really trying to understand the exposure, what are coping strategies, and what are effective interventions. Back to the heat action planning process. The idea is to kind of go from an individual place, recording temperature, so getting quantitative information, conducting surveys and workshops, and then sharing it back with the communities to understand if this made sense. And I just, there's a whole report on this, glad to send that link out. But for now, let me just touch on a couple of findings that are related to the built environment. The first is just the sensor we set up. We are finding that outdoor temperature peak hours before indoor. So when you see this dashed red line, about 4 p.m. is where the hottest point of the outdoor temperature is. But it takes a little bit longer for the buildings, each of these buildings with the purple, green, and light blue lines to actually increase in temperature. So we see the later part of the day increasing within these households. These are averages from 8 a.m. to 10 p.m. across the 52 households where these sensors were set up. Cooling center hours often didn't overlap with the indoor highest temperature. So when cooling centers were closing or not available, that's when the temperature in the indoors spaces were much warmer. We didn't find, at least in the first round, where we're still processing the data for the second round, we didn't find that those residences that had AC were necessarily cooler, excuse me, than the units that didn't have AC. So that was really interesting that we're kind of hypothesizing why that might be. The Northwest Tower, the purple line, was consistently had more days above 90 degrees. And this is a 1.3 days above 90 degrees on average Fahrenheit. And then we were able to also look at days above 80, days above 85. And for those Canadians, at least in the US, when we say residences above 80 degrees, that's usually above a CDC Centers for Disease Control and Prevention recommended level. So we're seeing majority of the households, residences that we monitored are in fact above the recommended level. And recall that these are often folks who are lower income, limited, and older adults as well, as we observed. few of the things that communities are noting about not using cooling centers, again, built environment response of trying to get, is that unable to get to the cooling center, that folks feel like they don't feel safe going to a public location, or that they're not comfortable leaving their unit. Nobody said that they think that heat is not dangerous. Everybody saw that as a very clear indication. So again, first preliminary data coming out on kind of response and coping and why cooling centers were not necessarily the go-to option for communities that we surveyed. Oops. Most common strategies were really using fans and then limited use of ovens or stoves during the summertime. Opening windows at night and air conditioning was another. Many of these households were just starting to get air conditioning, and that was something that really popped up, part of the Portland Clean Energy Fund and other state initiatives that have been moving through. And I will start wrapping up here with a last overview just as I come around the corner. So what I think this particular study suggests is that household scaled early warning systems are possible. We see that most people go indoors when it's hot. Most people die indoors and often at night. And so this was a process to try to gauge whether we could even develop an early warning system that can be part of households, and whether there's privacy and privacy concerns and things like that, that comes up, of course, in trying to conduct these. Most residents do experience physical impacts from heat. We saw that lower wooden structures were less hot than these concrete high rises, and that residents had many strategies for staying cool. Finally, a whole set of recommendations that came out of the study, really kind of moving towards systemic processes and trying to ensure that we have everything from individual response to maintenance, simple things like installing window screens, things like creating outdoor shade structures, or creating trainings for heat response and weatherization. These were very straightforward things that seem very likely to, at least from the community's workshop response point of view, would make a difference to them. Just want to close with this last slide and just kind of key takeaways is, our work continues to try to emphasize that hyperlocal, but in order to get that hyperlocal, we need to understand which communities are experiencing the most acute harms from extreme heat events. So grounding this work in the principle that all individuals have the right to be protected from climate-induced. I imagine I'm not speaking a strange language when I put that up there, or strange concepts when I put that up there. Shifting a burden of proof from the individuals to systemic processes. I think that's part of the conversation we're having here, to identify organizational policies, management practices that help to identify risks to marginalized communities, knowing who's amplifying spatial injustices from the built environment. And then finally, adopting a model of prevention as the preferred strategy to eliminate heat threat before it occurs. That's something that the BRACE framework and other frameworks that have been out for some time are really trying to underscore as well. So I'll leave it at that. I know my time's up. Maybe I went a little over. Sorry, Brendan. But I'll yield the floor and hopefully turn it over to Rachel.
Thanks so much, Vivek. If you have questions, you can put them in the chat or hold on to them for later. And right now we'll shift to hear from Rachel with the City of Vancouver.
Thanks, Brendan. Just gonna share my screen as well, if I can. Oops, sorry, just 1 second. All right, can everyone see that and hear me okay? I see you nodding. Great, thank you, Mariana. Okay, good afternoon, everyone. My name is Rachel Telling. I am the Manager of Climate Adaptation and Equity at the City of Vancouver, just north of the border in BC. And I'm going to, in the next 15 minutes or so, hopefully, speak about extreme heat and the built environment and our efforts here. So I just want to begin by acknowledging that the City of Vancouver is located on the unceded traditional territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And we have a lot to learn from them and unlearn with regard to climate resilience and stewardship of the land. Yeah, so just diving in, the things I'm looking to cover today is just starting with a bit of context around the climate up here and kind of the city context, going over some of our current efforts to address thermal safety in buildings, and then look at some challenges and future focus areas, and then wrap up so we can have questions. So just beginning with a little bit of context, this is a photo of our city. So we're a coastal city, mountains to the north of us, just over the border. And we're a city that traditionally has been very temperate, but like Seattle and Portland and most of you here, we've been experiencing a lot more extreme heat recently. And so we recently got updated climate projections from the Pacific Climate Impacts Consortium at the University of Victoria here in BC. And these showed a really kind of clear warming trend. This is obviously isn't new, this isn't surprising, but just kind of wanted to set the context here that we are looking at around 2.4 degrees C, and sorry to the Americans, I am going to be speaking in Celsius. So warmer temperatures year round with an average temperature increase of 2.4. We're looking at 3 times as many days historically over 25 degrees C and 9 times as many days over 30 degrees C. I think that's about 86. And then we're looking at more frequent and intense heat waves. So 4 times more frequent heat waves. And those heat waves will be hotter and they will last longer, and we'll see warmer daytime and nighttime temperatures. And then just start looking at kind of understanding of vulnerability, and this has already been covered really well in the previous presentation. But just understanding that this heat doesn't affect everyone equally, and we know from our work up here, and this is similar, I'm sure, to where most of you are located, that those who are most vulnerable to the effects of extreme heat are living in older buildings or living alone, have pre-existing health conditions or mental illness, are living in a low tree canopy neighborhood or exposed to higher effects of urban heat island, and are over the age of 60 or an infant or a young child. And we have done quite a bit of mapping in Vancouver. This is a map of our city to understand the difference in how temperatures are distributed across the city. So this is surface temperature taken on one of the days during the heat dome in 2021. And you can see there the red is the hottest temperatures. And these really correspond with our most kind of disadvantaged neighborhoods. So overlaying kind of social economic indices with temperature, we can really see the impacts of that and how extreme heat is not felt equally across the city. And also, just to set the context a little bit, in Vancouver, we are dealing with a climate crisis and we are dealing with extreme heat, but that's within the context of several concurrent challenges or crises. So we have an affordability crisis up here, a housing crisis, an opioid crisis, and just for those of you not familiar with Vancouver, we are a city largely of renters, and that's because we're also a very expensive city. Cost of living is very high. So over half of folks rent their homes. 35% of renter households are spending over a third of their income on rent. 62% of homes are apartments, and the average cost of a 2-bedroom unit is 3,700 Canadian, which is about 2,800 USD, which puts Vancouver as Canada's most expensive city for renters. So there are about more than about 90,000 buildings in Vancouver, and Vancouver has high standards for new buildings, but has limited tools to improve older buildings, many of which were not constructed for a hotter climate, having historically been a temperate location. And due to the affordability crisis and the housing crisis, the threat of displacement from renovations and demolition are significant considerations when we think about things like building upgrades. So just want to spend a bit of time talking about our current efforts to address thermal safety in buildings, and these kind of a range of different categories. So our extreme heat response really falls into these 3: improving access to cooling in public spaces, things like community centers, supporting indoor cooling and thermal safety at home, and stewarding the urban forest and green space to support outdoor cooling. That last one is really speaking about, reducing the urban heat island effect. And throughout the city's climate change adaptation strategy, these are our 3 focuses for this purposes of this presentation. I want to just focus on these 2, given that we're talking about the built environment, but know that we are doing other work as well on green space and urban canopy. So kind of diving into the improving access to cooling in public spaces, we, as most other cities do, have a network of cooling centres, misting stations and spray parks that we activate through the summer months, and been looking to grow this and to partner with neighbourhood-based organisations to have their own cooling centres. We've also been really focusing on undertaking cooling retrofits in civic facilities. So most of our community centres and libraries and other facilities haven't had cooling because they haven't needed to in the past. So looking to retrofit those so that they can be cooling spaces. And then recognizing that many of those who need cooling the most are not able to access the cooling centres. We will be starting a transportation pilot next year with seniors and people with disabilities. So this is effectively a taxi pilot that pays for folks to get taxis to cooling centres so that they can access those spaces. Oh, I don't know what's up with my animation, sorry. And then from, all of our research, we know that most folks who are at highest risk of cooling need cooling at home. They need to cool in their home in situ, and that is a far preferable option than trying to get folks to cooling centres. So we've been piloting a cool kit program with community partners over the last couple of years, and that's something we're going to be continuing to do to support vulnerable residents sheltering at home during extreme heat events. And so cool kits are made up of a thermometer, towel to dampen, a cool gel compress, water bottle, spray bottle, a small tote, and provide residents with supplies that help them monitor their home's indoor temperature, and they can also use to keep cool. And so these cool kits are assembled and distributed in partnership with community serving organizations such as neighborhood houses. And simple instructions are available online for those that want to create their own as well. And this is a partnership with Vancouver Coastal Health, of which some of our colleagues are here on this call today, as well as a number of community-based organizations. We've also been doing kind of alongside that a DIY air filter program as well. So we have, we have air quality issues in summer as well for wildfire smoke that are often compounded by extreme heat. So looking at trying to provide a kind of low-cost, accessible way for folks to clean their and their homes as well. And then continuing to try and understand vulnerability. So we have been undertaking a multi-year indoor temperature survey with Vancouver Coastal Health and the BC Centre for Disease Control. And this is kind of a survey, an online survey that goes out during extreme heat events and asks folks to kind of monitor the temperature in their home and log that temperature at different times, and also give us some information on their building age, building type, exposure, and what measures they're taking to cool or not cool. And so that's been running for the last 3 years, and we're looking at we're analyzing the data now and developing a report to help guide future extreme heat response in Vancouver based on that. We're also looking at reducing barriers. So in BC, the Strata Property Act and the Residential Tenancy Act currently both have language in there that can prevent people from installing portable air conditioning or even putting coverings on their windows. Stratas are able to edit this language, but many stratas don't know that, and they just copy and paste the standard language in the Strata Property Act. So we're advocating to the province of BC to remove some of that language and make it easier for folks, especially, a lot of our most vulnerable residents are renters or tenants. They really have very little control over being able to cool in their own homes. And kind of going back to what I said previously about the housing crisis and the affordability crisis, folks often feel that they are kind of precariously housed and don't want to do anything that might upset their landlord or put them at risk of losing their housing. So making it easier for folks to feel comfortable and confident to be able to cool in their own home is really important. And then we're also launching a multifamily heat pump incentive and owner support program with BC Hydro, which is our hydroelectric supplier here in BC, the province, and the Zero Emissions Innovation Centre this year. Rebates historically in Vancouver for heat pumps have been focused on single family homes and not at apartment buildings or multifamily buildings. And that's really been a gap. So that's something that we are going to be piloting this year. And that it's also a measure that really for us hits on, climate mitigation and climate adaptation at the same time. So is a great strategy. And then looking at regulatory levers, in Vancouver, we have our own building bylaw. So we were able to kind of set and adjust our bylaw for Vancouver quite easily. And so we are introducing requirements for mandatory cooling in new multifamily residential buildings from next year. So any new building will have to have cooling. Obviously, that's great for new buildings, but the majority of our buildings in Vancouver are existing buildings, and it's a lot harder to retrofit those. So we're also doing some work to explore the legal, technical, and economic feasibility for measures to reduce temperatures in those buildings. And so we're looking at things like, can we set a maximum temperature bylaw? And then a number of cities across North America are doing the same thing. So working in partnership with a number of other cities to look at what could a maximum temperature bylaw look like, what is the programming that we need and the supports that we need to have in place for that to work. How would it be enforced? How would we limit things like rent evictions, etc.? So it's a complex challenge and one that doesn't have an easy answer, but we're doing a lot of work to look at what are the different policy and regulatory levers that we have that we might be able to use, and what are the supports we can put in place to ensure that it's done equitably and safely. And then we also have a number of studies and pilot programs. So these two, the Rental Apartment Retrofit Accelerator and the Nonprofit Resilient Retrofit Grant, are two active pilots that we have, one for non-profit housing and one for market rental buildings, to look at improving resilience, largely through adding cooling while minimizing tenant disruption. And so we're funding a number of buildings to do this through 3.5 million grant funding from the city, plus 1.5 million from Clean BC and a number of other funders. And we're looking at electrifying around 15 existing buildings. And the idea here is to kind of just do the retrofits and learn from them and see how we can inform future policy and support through these. And there's been it's been really very popular, as you can imagine, lots of applications and interest. And we're looking to complete the retrofits by 2025 and to, take those learnings and help inform future programming. And then we're also doing at the same time a study on cooling measures in existing multifamily buildings with Vancouver Coastal Health again, Metro Vancouver, which is our regional government, and the city of North Vancouver, which is a municipality just to the north of us, to look at what are the short, medium, and long-term strategies for reducing heat morbidity in existing multifamily buildings. And that's everything from active cooling, heat pumps, through to passive cooling and building design. So what are our challenges and future focus areas? So I mentioned this a lot already, but thermal safety in existing multifamily buildings is really our big challenge here in Vancouver. Most people are living in existing buildings, really high proportion of renters with kind of little control over measures they're able to put in place, and a regulatory environment that makes it very challenging to do retrofits. So that's really our focus at the moment, as well as how to develop policy and program in an equitable way that reduces the risk of renovations or displacement, and that doesn't exacerbate the housing and affordability crises that are really affecting things up here. So that kind of speaks to the navigating concurrent crises, and then sustainable funding at the scale required. So cities are at the forefront of climate adaptation and things like extreme heat, but we don't have the funds to take on the challenge at the scale and pace required. So we're really looking to senior levels of government, the province and the federal government, to step up and partner and support us with long-term funding to really tackle this complex challenge. And that is the end of my slides. I think I got it just within 15 minutes. So happy to take any questions, and I'll stop sharing.
Excellent. Thank you, Brendan. Let me, sorry, go ahead, Brendan.
Oh, I was just gonna give a hearty thank you to both Vivek and Rachel, and appreciate you both spending the time with us today. Now we have the exciting prospect of question and answer, and I'm excited to invite Rachel to lead us in that.
Sure, thank you. And yes, echo the round of applause. I see some reactions coming on, so feel free to throw the gratitude into the chat, and as we go into a Q&A session. Thanks for joining today. My name is Resham Patel. I'm on faculty here at the University of Washington in the School of Public Health, and part of the Center for Disaster Resilient Communities that's helping to coordinate this. So excited to work with such excellent partners in practice and leading this project, and happy to serve in moderating what I think will be a really exciting question and answer period with our amazing speakers here. So I wanted to start with the context of the Pacific Northwest, since that's really, I think, at the crux of why we've come together. Both Rachel and Vivek touched on this a bit in their presentations about our locality. And Rachel, you were just mentioning about affordability and housing and opioid crisis. Vivek, I know you touched on the AC initiatives throughout Portland and the timing of that during this, but just want to broadly ask you both, what would you see are some of the additional challenges that are unique to the Pacific Northwest that make some of the best practices that were identified in hotter climates elsewhere even more challenging here locally? Again, you both touched on some of them. Just wanted to bring that one back, a question that was submitted into us via registrant, so I wanted to prioritize that.
Rachel, do you want to start, or?
Go ahead.
Okay. Well, I mean, maybe just because there's so many, I think I'd just start with 3 categories. And good to see you again, Resham. The infrastructure wise, I'd start there. I mean, our buildings, the way that designers, architects look at an area when they're siting a building and they're putting up specs is on specific climate. There are specific climate conditions that they're designing for. And so you begin with just the structure itself not being necessarily attuned to what we're seeing happen in terms of the extremes that we're seeing. And so the quality of the materials, so everything from the materials that are used, combined with the opening operability of the windows, combined with kind of the extent to which HVAC systems are kind of established and, not just in new buildings, but are able to be retrofit in existing buildings. So there's a whole host of things there. From a social point of view, I think we have a lot of work to do with not just the building codes and the policies, but also kind of communities and their kind of adaptive or maladaptive strategies for responding to extreme heat. There's a lot of conversations I've been in where communities are very straight about saying, it gets hot, but it's just a couple of days, I'm good. And or it can be really idiosyncratic in that, I can just get out of town, or I have access to it. But communities that we talk to are often caught flat-footed and not knowing what to do in those situations. So there's a lot of socializing to do there as well, particularly in communities that are in manufactured homes, which are abundant in at least the Multnomah County area. There's a lot of increasing number of multifamily homes that don't have the kind of energy or cooling options. I think so. There's a lot there. And then from an ecosystem point of view, I think we all know that our ecosystems are also experiencing enormous impacts from the extreme weather that we're seeing. And so there's the shade that we thought we could get from trees in the green space is actually far more challenged, because the trees and the green space are challenged not only by the heat, but the development pressure that our cities in the Northwest face. So just a few very high level responses to that question.
Yeah, that was a great summary. The only things I would add, I guess, on the infrastructure side, very few people have air conditioning here compared to other areas of the country. And so, it's we've been talking to folks in Arizona, folks in other parts of the US where they can implement a maximum temperature bylaw in a quite straightforward way because the infrastructure largely exists. For us, it would be a complete overhaul of infrastructure, looking at retrofitting like tens of thousands of buildings. And associated with that, we are largely powered by hydroelectricity here in BC, and the grid. There are questions over the grid's ability to, add air conditioning to 70,000 buildings. And kind of associated with that again, as we are seeing hotter, drier summers, more drought conditions, that in turn affects our ability to generate hydroelectricity. So kind of like a complex web of kind of systems issues here. And then I would also add, we are on top of extreme heat, we're also seeing wildfire smoke, like compounding extreme heat events. So, in summer, folks don't know whether to open their windows to get air to cool or keep them shut to keep the air cleaner inside. Like there's no straightforward solution because of those compounding impacts. And again, with drought, the same kind of thing. So yeah, challenging.
Complicated. That's the takeaway, right? And I think that's important that you highlight the compounding impacts. So thank you for highlighting the intersection between those, and Vivek for outlining it into those three categories. I think you both hit on, and I know a focus area that Rachel, you just highlighted around the cooling and air quality requirements in terms of what's built into codes for new buildings or requirements for existing buildings and some of the complexities and challenges there. So feel free if there's something you'd like to add to that, but I know that was an area of interest brought forward in questions. I think a live question that came in that hits on something that you both brought forward in the spirit of why our area and why is it different? We have a question about the published danger zone for indoor temperatures and where it's higher, and thinking about that rationale for temperatures that people are usually unable to effectively cool themselves without external intervention of some kind. And I think the question here is the difference between BC and Washington or Portland, Oregon. Does anyone know why the threshold is different or lower in the states where, if anything, the average temperatures would be expected to be higher and the local population would be, in theory, more thermally adapted, though you both brought up ways in which communities may not be. So just in terms of either specifically on that question, or if any of our other colleagues want to speak to that, why there's that discrepancy, and I guess maybe how you also combat that. So Rachel, you brought up the Arizona example specifically. I think if I'm understanding the question, and feel free to hop in, but that was a live question that came in.
I guess just real quick, maybe a quick response is I don't know of any empirically documented research that really examines this systematically in and around North America. I mean, it really is often done by local public health and planning agencies in terms of determining, like, for example, in the US, like we have federal guidance that says 65 degrees Fahrenheit is the base. Every habitable room has to be able to get up to 65 degrees Fahrenheit. Like that is federally directed requirement, as opposed to a maximum temperature. We don't really have much guidance. So it really falls upon local agencies to determine what is most relevant. And that I've just seen as being a relatively idiosyncratic process, and not really having like the kind of dose response and the epidemiological evidence. And maybe others have some insights into that, but I just don't know of any kind of comparisons that have looked across their studies, in part because we're trying to assemble the data to be able to look at that right now.
I think that's a really great point. In terms of the data, I'll ask a follow-up question on that. That's a nice plug for some future work that we're doing. But let me see if any others on the line, either Rachel, you, or any of our colleagues who are kind of helping with the collaborative, would like to share more on that. Go ahead, Brendan.
Yeah, I had a chance to ask this exact same question to a panel of folks who are experts on the sort of the biological response to extreme heat. And I think Vivek is right that uncertainty in terms of the dose response or what exactly is the danger zone is probably the driver here. I couldn't really nail them down on an answer, to be honest. But I think their consensus was somewhere in that range of 28 to 31 Celsius, or 80 degrees, give or take a few.
I would just jump in. It's Craig from Vancouver Coastal Health. We benefited here from, I think this is like an example of how a bunch of different parts of this system work together. But there was a researcher in the University of Ottawa, Dr. Glenn Kenny, who he actually had, I can't remember what the contraption is called, but it's a place where he can measure the body's response to heat I think in seniors. And anyways, our BC Center for Disease Control, Sarah Henderson, who spoke last time, I think was kind of instrumental in pinning Dr. Kenny down to giving us these thresholds of 26 Celsius and 31 Celsius that Chris mentions in his question. So that's kind of how all that came to be for us. And Michael might have a better sense of the science around this. I don't, but I would think it's the best they can do with a really great research lab. There's probably some uncertainty. It doesn't apply to everybody equally, but we were really grateful, I know, to have these thresholds to use in our work.
Yeah, excellent. Oh, go ahead, Michael.
Yeah, I was just going to say, and I appreciate Angela Eichelbosch just jumped into the chat just with a comment on a report coming out on some of this work. Naturally, the population of people and older adults with different pre-existing medical conditions, medications they might be on, and so forth do vary a lot. So getting to a specific threshold, we always stress that these are sort of averages coming from this research, but there did seem to be, without stressing people to the extent of inducing illness, that there did seem to be physiological responses that hinged around those thresholds and the assessment of these researchers at the University of Ottawa that we found them convincing, and we want to continue to evaluate, and if there's new evidence to bring that on board, rather than just repeating it so that people cite it because they heard it cited somewhere. Naturally, that's an issue too. But that, as Craig described, that was from some of that lab human physiology research that's just been conducted in Canada. While I have the mic open, Resham, if it's helpful, I could speak to this comment on air conditioning for renters. This is a major issue with BC Hydro's, our main power utilities program, in cooperation with other provincial ministries to distribute air conditioning to people who are at higher risk, and it is means tested. And some of the other incentives that are there for retrofits and so forth, so many of these come in the form of tax rebates or different mechanisms where someone needs to go out of pocket several hundred or thousands of dollars to conduct these retrofits. So it's really good to see the attention to the sort of equity focus that the city of Vancouver is bringing, that Rachel's describing, making sure that people who are renting their units or people that don't have that capital present to make these interventions can still access all of these benefits, and that it's not just something that you with a very high threshold to participate. And so from a health perspective, we had flagged to the province a couple of the issues, included the fact that one needed to be the person on record for the power bill, because this is administered through our BC Hydro program. People do need to be the person on the power bill, which isn't always the case for renters, depending on the nature of the unit, the building. If it's even a room within or a suite within a house that's been subdivided, not everybody is the billed person. A letter of permission or a signed form from the landlord was seen as a huge barrier. We have in our trying to work with people with direct lived experience of some of these risk factors, have a lot of feedback that people don't want to ask their landlord to fix a tap, and they definitely don't want to ask their landlord if they can put in an air conditioner or a mini split, or if they can do a small renovation on the window to handle the outflow. All of those things, people do not want to go there in an environment where they fear that any excuse at all, they might find themselves evicted, and that I think that perceived and in some cases real risk is pretty real. So I think that the lowering the barriers to renters to access these programs so that they, in some cases, that it's been flagged that legally the engagement of the owner of a home might be necessary for some interventions, but for some of these less intrusive interventions, like putting in a portable air conditioner, we'd really encourage that we find ways to do that allow that to be in the hands of the resident of a unit and don't require a lot of administrative burden on them or a landlord. It's not always realistic that people are going to complete all of that for a number of reasons. So it's a great question in the comments from Sonia, and I think that something that local and provincial governments are pretty live to, but we have a ways to go, in my view.
Can I just add one comment, which is kind of the elephant in the room here, which is humidity. So like I think it's fantastic that we have, you know, these temperature thresholds, and for as policymakers, like we kind of need that, like a number, an average to point at, and recognizing that, as Michael says, you know, there are a number of factors that affect how and where folks feel the effects, but in Vancouver, and I'm sure in most of your jurisdictions as well, like with the humidity we experience on the coast, temperatures can feel like 5 degrees Celsius higher than they actually are. And I don't have an answer to that. I just wanted to kind of point out that that's something we struggle with a bit here in terms of like that wet bulb temperature. It's like, what actually, if when we take humidity into account, what actually is the safe threshold, and does that vary based on kind of the the weather conditions? And I think that is something, again, that's different to other areas of North America where it's a dry heat and it's pretty kind of like stable in terms of those conditions.
Yeah, that's an excellent point, and tying together a lot of this conversation around data and evidence gaps, and some of the potential opportunities to look at research or understand further threshold with all of those nuances in mind. Make a little plug there, as we've been talking about in this last conversation about thresholds, which was kind of tied to our last webinar as well on terms of early warning systems. We see this thread, and part of one of the reasons we want to do the collaborative is understanding the priorities across various sectors related to climate and health, and also understanding opportunities for us to build that evidence base, to think about those research opportunities. What are those pressing questions in practice that allow folks to do this work on behalf of the communities, but without that information, with information gaps and without that evidence, how are we able to do that and prioritize it well? So I'll pivot us back to our thoughts on this webinar in terms of built environment. But I think with that thread in mind, if there are opportunities to think on research questions, Vivek, I know you were outlining some of the data that's come forward, and with respect to built environment, please do highlight those, or folks in the Q&A, your ideas as we move forward. I'll make a plug for this in a few minutes as we move forward with this project. That is one of the things that we want to do, building off of these webinars, is think about, well, what are the partnership opportunities in the future? Coming back to kind of our built environment questions, and as we were thinking about thresholds, there's been a couple of questions in terms of cooling centers or cooling strategies. So I had one that was about in response cooling strategies that our first responders, emergency scene personnel, fire, paramedics use in the field, and if there's any of that would be useful for individuals in their home setting, and how we, as particularly those of us in public health or health departments, could think about that. So a thought question maybe. And another one related to then cooling centers, and as we think about our built environment, how can they be transformed to think about deeper impact resilience hubs? And I know some of your jurisdictions are looking at resilience hubs that could be suitable for addressing multiple hazards. So those are both kind of on the response side of cooling. Just see if folks have some thoughts on that. that they'd like to share. And then I'll ask probably one more question that's come forward around around some of our built environment. And Rachel, as you queued up around kind of green infrastructure and planting, but I'll hold that one, but just to tease it in your mind. So cooling, strategies on cooling.
You go, Rachel? I mean, yeah, go
Go
ahead.
for it. I feel like I spoke about our cool kits and cooling centers and things. So yeah.
Yeah, maybe if that's to me, Resham, I mean, my general sense is that just the cooling center, starting with that one, is that our learning from the communities who would be potentially the audience to use cooling centers, I feel like that's where I tend to go immediately. Like, I want to know what a community member who is potentially likely to use a cooling center, what their thoughts are about it. And so these workshops that we've been doing with public housing residents who don't have necessarily cooling options they don't have a resilience hub in their building or anywhere nearby. That's kind of where we've been going to ask, what's keeping you from it, and how are you, what are things that would encourage you to use it? Are there things that, and I've heard lots of things anecdotally. We're trying to create a little bit more of a seasoned description of what are the general themes that are coming out from cooling centers. I know that generally speaking, the city, at least Home Forward, was really thinking about kind of cooling kits and things like that Rachel mentioned. And part of the conversation has gone to like, how do we actually think about a hub that's easy to access, that's potentially in the building? But I think the retrofit on that just seems really hard. I mean, I don't think there's many property managers or others who would be willing to let go of, 200, let alone 500 or 700 square meters of space in a building. So the next alternative is to identify those resources immediately adjacent. I think Brendan and Bradley and others could probably speak to that more effectively in terms of the spatial distribution. We did publish a paper about 5 years ago that looked at presence of cooling centers and accessibility to older adults in the Portland area, and found that location matters quite a bit. And then we also found that translation, found that government versus nonprofit sponsored cooling centers might vary quite a bit. So in terms of perception of the audience. So yeah, just a few thoughts. Definitely an area worth digging into.
Yeah, thank you for that. Oh, Rachel, go ahead. And I
Yeah.
was gonna just ask Brad to jump in too. But go ahead.
Thanks. Yeah, just to add, since the heat dome, we've done quite a bit of work with neighborhood-based organizations to talk to folks and figure out like, do cooling centers work? Can you get to them? Like, and our kind of main findings have been those who need them the most can't get to them. So those with disabilities or seniors, like they need cooling in home, and they need mechanical cooling in home because they feel the effects of heat at a much lower temperature. And the barriers to that are significant, from them not being permitted by their strata or their landlord to put cooling in, through to like just physically not being able to plug in a portable AC. Like they just need someone to come and do that for them. And the other thing is, when folks do access cooling centers, there's nothing for them to do. Like they're just sat there like bored, basically. So we've been working with like our libraries and community centers to think about programming, to think about like, how can we actually make this a place somebody wants to come, rather than kind of just like a very last resort for folks to feel cool. So kind of trying to build a bit more of that community and the programming around. So I'd say those are the two main focuses, and with the transportation pilot as well, looking at like, how can we actually help folks to access these cooling centers.
Yeah, I imagine that's part of Angela's note in the chat, that the mall is more fun. But meeting, as you both bring up, meeting community where they're at, and trying to address those barriers, and really lean into the facilitators and the ways in which folks want to come and be part of what the community identifies with. I'll just see if, Brad, you wanted to share anything from some of the work going on in Seattle and King County, I know, on resilience hubs.
Yeah, thanks. Brad Kramer, manager of a climate and health equity initiative at our Seattle King County Health Department. I liked how Vivek ended the slide deck with the focus on shifting to prevention, and so a lot of us have been reacting to these episodic events and shifting towards prevention. So I think coming up, all of these solutions, the cool kits and others that focus on prevention are still under development, and we're looking for everyone's great ideas. And in terms of cooling centers and moving towards resilience hubs, like, please keep asking that question. I think there's definitely room for that, and we should start planning for that to address all climate events, and shifting to more attendance into cooling centers. And so one thing that we did that I thought I would like to share is we did a proactive survey of a neighborhood or a couple neighborhoods in Seattle and South Park and Georgetown to see what their interest in building resilience in their communities, and if they would be open to a resilience hub and how they might use it. And so we did a door-to-door survey using a technique, a method from the Centers for Disease Control called CASPR, and so we call it SASPR for Seattle. But and so I'm going to link to a story map around that. Similarly, the city of Austin did this recently using some of the same questions that we used, and also looking at resilience. And they asked about resilience hubs. And so I'll also share that link, and you can begin to see some of the results that they're getting. But that is one way to start engaging community as we plan for this sort of all hazard center, and it's something other jurisdictions could consider as well.
Thanks, Brad, and thanks in advance for throwing those links in there. Both the SASPR full report with those questions is available, as well as this story map that I think many of you will find interesting. And an example of, as we were talking about, research gaps and partnerships across public sector agencies, researchers in academia and community certainly leading the charge there. So a lot of opportunity, I think, to explore those types of partnerships and questions and priorities in the future. I think this last question that we were just discussing, and the points really in the responses from the speakers, and really gets to where I'll make a plug for where we're going with next steps. So I'll leave it there with the questions in our question and answer period, because I think this is a nice segue both to our breakout rooms that we wanted to give some time to, as well as to plug our next webinar, which really gets to this idea of community partnerships. It gets to this idea of thinking about what's the priority for the community, how do we center our work around community, and so that'll be coming up here in March. Mary Hannah, if you're able to pull up the slides, and if not, we will be putting things in the chat here. But I wanted to start by saying thank you to our panelists again, and thank you to others who jumped in on the question. So another virtual round of applause for our panelists. And for those of you who have additional questions, I think we got to some of the bigger picture ones, but I know there were more around greening and built-in environment and infrastructure. So please do stay on the line. We're going to go into breakouts in just a minute. But just as I mentioned, we've had the earlier webinars, both on kind of peer sharing the experiences from the heat dome, as well as the early warning systems, where we talked about thresholds in communication. This topic around the built environment now leads us into our fourth and final webinar as part of this series on extreme heat events and community partnerships. So that's on March 14th, and you see the webinar registration link just added to the chat. So we hope that you'll be able to join us there. For those who have, like, as I mentioned, follow-up questions or specific ideas or collaborations or questions about the project more broadly, we're going to go into these breakout rooms. If you need to sign off at this point, we really just genuinely thank you for your time and your great questions. So far in this webinar series, you'll be getting a link for today's webinar with a questionnaire for feedback, as well as the registration link for March. And I just will also make another plug, and again, in the spirit of partnership, As we talk about broadening beyond extreme heat, there is a webinar or session on a related topic of wildfire recovery and coordination with disaster preparedness and emergency management. I'm sure there's many more opportunities in the spirit and space that we're bringing together. So that event's taking place tomorrow, and we'll add a link to that into the chat, and some of our partners from this call are involved with that as well. I think that's hosted kind of more across the Washington state spectrum, but we'll add that link in for your reference as well. With that, please do stay on the line if you're able to and have questions, but if not, then we will see you at our next webinar or in future activities. And we'll go ahead and get those breakout rooms set up here in just a minute. What we'll do is we'll separate the breakouts. So we'll have one room that Vivek will lead and be available for additional questions, along with likely regional partners from Multnomah County. One that Rachel and her counterparts with the Vancouver, BC contingent will be housed at, and then one with Brad Kramer, who you just heard from Public Health Seattle King County, and some of our King County partners will be in a room as well. And so then if those who are not joining a breakout room, I'll stay in here in the main room as well. And you don't have to go to the region that you're from. You can go anywhere you like. But just again, an opportunity to ask those kinds of questions. And as I mentioned, that wildfire recovery webinar that's tomorrow, we'll throw that link into the chat. And that's again, something that our King County and Washington state partners are part of. That includes a focus on built environment as well. And so there's another webinar that Mary Hannah will be putting in for March, and that one of our partners at Public Health Seattle King County is participating in. And so, Mary Hannah, if you can add the link for Danya's webinar. Again, it builds on this topic of the built environment. As we mentioned, we saw today speakers from Portland State University and Vancouver, BC. So for those who are interested in hearing more about what King County is up to in the space of built environment, you can see that that link that went into the chat right now. Okay, with that, we'll open up the breakout rooms. You should be able to see that on your Zoom bar, so feel free to join the rooms, and thank you so much.